Coming up, we have everything you need to know about the new COVID-19 vaccines from a leading expert at the Indian Health Service. We meet one of the experts behind the nation's most up-to-date and complete database on Indian boarding schools. Plus, Alzheimer's disease and dementia create unique challenges for Native American caregivers. We have those interviews, plus headlines ahead on the ICT Newscast.
This program is made possible by the Corporation for Public Broadcasting, a private corporation funded by the American people.
The ICT Newscast is sponsored by the Indian Land Tenure Foundation, a nonprofit organization serving American Indian nations and people in the recovery and control of their rightful homelands. On the web at iltf.org.
Support for the ICT Newscast with Aaliyah Chavez comes from the Arizona PBS studios in Phoenix at the Walter Cronkite School of Journalism and Mass Communications at Arizona State University.
Amadawahopa. Thank you for joining us. I am Aaliyah Chavez. We start today in Montana, where Indigenous families have been thrown into advocating for funding, for answers, and for awareness. It is a national issue that experts have long deemed a crisis, that is, of missing and murdered Indigenous people. Wheels and flowers are the focal point of this roadside memorial in Hardin, Montana. It is to remember 18-year-old Kaysera Stops Pretty Places, whose body was found here 5 days after she went missing.
We started advocating because there was just no investigation going on, no proper communication or anything to help us. They actually didn't even investigate her case for over a month.
4 years later, and there are still no answers about how Kaysera was killed, no named suspects, and no arrests. Even though federal officials have started initiatives to combat the nationwide crisis of missing and murdered Indigenous relatives, these families aren't waiting any longer. They're taking matters into their own hands.
Bonnie Three Irons, Richard Whistling Elk, Franklin Whiteman.
Families here in early September watched as the final touches were put on a new billboard along Interstate 90. It has the names of 48 victims from the Northern Cheyenne and Crow nations.
And we wanted to do that to humanize the numbers and to bring names out. And in instances, families that have multiple murders.
This large installation was made possible through family contributions and nonprofit groups. Some of the families wore blue shirts to remember their relative Victor Three Irons. The father of two died in early 2023, and his suspected killer remains at large.
It's become really apparent that if we don't keep moving forward with our advocacy, keep being their voice, this is just going to continue.
Reporting from Phoenix, Arizona, Aaliyah Chavez, ICT News. Now heading to North Dakota Federal Court, where a lawsuit has been filed against the Washington Commanders. The Native American Guardians Association, or NAGA, is suing the Commanders for defamation. They say the football team and key leaders made a coordinated and willful effort to defame NAGA by referring to the nonprofit organization as fake. NAGA started a petition in June to restore the former R-word name, and it received over 132,000 signatures. The R-word name, which is a dictionary-defined racial slur, was changed to the Washington football team in 2020 before landing on the Commanders. The National Congress of American Indians, as well as just about every other major Indigenous organization, say the team should not restore its former name. A Commanders spokesperson says they believe the lawsuit has no merit and they will be addressing it in court. And those are the headlines for the ICT Newscast. The Centers for Disease Control and Prevention recently issued recommendations on the newly released COVID-19 vaccine. The agency advises that all Americans 6 months or older receive the new shot from Pfizer and Moderna ahead of the fall season. I spoke with the lead expert on medical and health topics at the Indian Health Service about this. I started with asking Dr. Loretta Christensen why it's important for folks to get the updated shots when it becomes available to them.
Well, first of all, thank you for having me. And it's very important to keep updated with the latest vaccines because they're crafted in a way to optimize the ability to fight off COVID depending on the variants that are circulating throughout the country. So we have to keep up with the changes in the vaccine so we have the most updated, most effective vaccine available for our population.
When will the IHS actually physically receive the new vaccines?
Well, it's a very complicated process that we are completely prepared for, that we've set up ahead of time. We have all our methods. We've been giving education on the rollout of the new vaccines when they become available. And we just have to basically plug it in our system and get the supply chain moving. So once all that is ready to go, we are ready to go. And all of our facilities can order those vaccines, whatever is available. They will have that choice between certainly the Pfizer and the Moderna, which are already approved by the FDA, and then pending approval would be also the Novavax vaccine. And that would be sent to them, and they can begin administering it as soon as they receive it.
And will the vaccines be free of charge for people who get them at IHS?
Yes, all of our beneficiaries will receive any COVID vaccines, and actually all of our vaccines through our system with no charge ever to the patient.
And can you talk a little bit about the safety of these vaccines? I know that that's something that people are always curious about. So are these vaccines safe?
Yes, a lot of investigation is done on these vaccinations before they're approved. And certainly we have a history in the IHS of a very robust safety tracking of all the vaccines. And we track this all the time. We have great results. We're able to notice if there's any trends, any untoward incidences, and we track them very, very carefully. So we are very prepared to give out this vaccine, and we feel it will help protect our population. So, there's always things that you can have a reaction to, but we do present that education to our public and our patients to make sure they understand those reactions like soreness of the arm, a little bit of redness, maybe some little bit of fever and muscle ache. And that's routine with pretty much every vaccine.
We've heard so often about new COVID-19 variants, and right now there, of course, are a few that some are concerned about. But I want to ask you, in your expert opinion, how concerned you are about the new variant?
Well, the American Indian Alaska Native population is always more vulnerable due to the health status that we deal with on a daily basis. So as we suspected that COVID would hit us very hard, we are very vigilant when there's new variants. I anticipate this will continue to happen, just like the flu has changed so many times over the years, and we do an annual flu influenza shot because we try to capture what will be most effective for our population. And the same thing I think will become of the COVID vaccines. It will adapt to what is circulating and is of concern to us across the United States and certainly across the American Indian Alaska Native population. So we will continue to see this. We know because of that vulnerability, we still say really good hand hygiene. If you're coughing, you're in a closed space, you might want to choose to wear a mask. And we just tell everybody to be very vigilant because our more vulnerable can, of course, get quite ill from getting COVID.
Dr. Christensen, I'm so happy that you brought up the flu. For folks who want to get the new vaccine and the flu vaccine, is that something that they can do?
Absolutely, they can get that in a visit to any one of the facilities. We do recommend, I want to add, we call it the tridemic. We're looking at this season of COVID, influenza, and RSV. So anyone over 60 and pregnant persons, and of course our infants, should be treated for RSV because all three of those can have very similar symptoms. And the better we can prevent any vaccine preventable disease, it's a benefit to the population. So if they get all those vaccinations, that drastically decreases them having get one of those three things: the flu, RSV, or COVID.
We saw early in the pandemic that COVID-19 was disproportionately affecting American Indian and Alaska Native communities. Are you still seeing that same data, or what are you seeing right now?
We are still seeing that data. I will say, thankfully, it's better. At the beginning of COVID, we were over 4 times more likely to have a death from COVID. We were 3+ times more likely to be in the hospital, and we were over 2 times more likely to get COVID. Those numbers have settled quite a bit, and I think a lot of that is because we had such a positive vaccine experience. We got it out into the community, the people stepped up. And because of that, we saw the mortality go down, we saw the hospitalizations go down, and we saw the cases go down, but they still are higher than most of the general population.
If I am someone who has already gotten COVID-19 and I recovered, should I still get the new vaccine?
Yes, because you can get COVID again. You know, anytime that you are exposed to COVID, you're at risk for having a new case of COVID. After a case of COVID, you do have some time period up to 90 days where you're fairly well protected by your own immunity, but you can get COVID. So you may have it once or multiple times. And then for those few that are very, very lucky that never had it, then that's good for them.
My next 2 questions will be just a little bit of a refresher. Can you tell us what the current symptoms are for COVID-19? And if you test positive, what you should do?
Okay, well, you know, the symptoms, they do vary a little bit with the variants, but it's typically a sore throat, fatigue, muscle weakness, and fatigue, stuffy nose, slight fevers, and definitely people feel very tired at that time. I'm sorry, as far as what you do want to isolate. You know, if you do, we have all the at-home testing. Once you test positive, you want to stay home for at least 5 days, hopefully 10. If you must absolutely go out, you have to go out with a mask. And if you're in a family or a close situation, all of those people should test on the 5th day after being exposed to you if you're positive for COVID. And we do recommend masking in that case, so that if they go out and must go out, that they will wear a mask around other people so we're not creating more exposure. So we still recommend the isolation.
Well, Dr. Loretta Christensen, thank you so much for your time today.
Thank you. Thank you so much for having me.
The National Native American Boarding School Healing Coalition does powerful work addressing the lasting harms of a troubled era. One key component of the effort is building a list of all of the institutions involved and mapping them. ICT's Stewart Huntington visited with Deidre Whiteman from the coalition to talk about her database work.
Mirakiapi, Chantewashte Nape, Chuzapi, Aishkian Wachiankapi Deye, Deidre Whiteman and Makiapie, Maniwaka Oyate Himataha.
Deidre Whiteman, welcome to our show.
Thank you.
The National Native American Boarding School Healing Coalition has just released some powerful new data and tools. Tell us about them.
Yes, we just released our digital map. This digital map was years in the making. We collaborated with the National Center of Truth and Reconciliation out of Canada. But previous to that, we didn't have a digital map, but we had a map that was more of a resource for people who would come to our page. But now this map is more interactive, and it's able to give you more information and more details if you're looking for a certain and specific school and location.
And you guys continue to grow the number of institutions that fall under this era of American history.
Yes, we do. We recognize that it's going to be ongoing. As you know, in 2020, we just released a map in 2020 with 367 schools. And so right now in 2023, we're at 523 schools. So we know and recognize that this is going to be an ongoing research process.
The lack of data and access to records has helped keep the facts about the boarding school era in the dark. You guys are doing some amazing work changing that.
Yeah, it's very important work. The feedback that I've been getting and receiving from just community members, family members, and friends is that this hasn't been done before, and then to see it on a larger scale, especially with our digital map, it's truly gives you I guess a kind of a glimpse into how these policies that were put into place to put children into these schools and these institutions, it goes to show that there was no link when you see the vast number and then you see it more in a visual scale. And so it's for myself, it's pretty heartbreaking, but it's also makes it, I guess, I don't want to say inspiring, but it also makes me want to know more about my family's history, especially my grandparents who went to these schools. And it, for myself and my family, I know it's part of our healing process. I grew up knowing that my grandpa on my mother's side went to boarding school, and I just seen how it affected my family just on my mother's side. And so even as a child, I was 8 years old, and I understood what a boarding school was. I understood that it wasn't a good place. It was a place that where my grandpa went and he was changed. That was my concept of boarding school at that time as an 8-year-old. And I've seen how it shaped and changed our family. So this project for myself is it's like a healing. It's a healing in of itself. And I just hope that, other families are able to, navigate through this information and find out more about, their family's history as well.
What are the next layers that you hope to put over this map?
A lot of questions have been asked, is how many students were at these schools, what tribes were represented. And that information is really, we have to do some, we're only a team in my department, we're only a team of 2, and there's 523 schools that we still have to get more information from. And so our organization is really committed and wants to further find all this, additional research. And that's why we are advocating for our bill, our Truth and Healing Commission bill, S-1723. So if this commission is passed in legislation, it'll give us access to these records, and it'll give us have a more formal inquiry into, the records and more information into these schools.
Is it painful sometimes when you meet the people, the families, the descendants, and the survivors who have been through some of the horrors of the era?
There's only one word to describe it, and for myself, it's very heartbreaking. But it's also fuels my passion to know more about the history, to continue on with this work. When I have the honor and the privilege to sit down with a survivor, and then and I'm able to listen to their story, it just it is heartbreaking, but it also, like I said before, it just really compels me to keep doing the work that we're doing, because it's important. It's really important work, and everyone needs to know that this is what happened, and we still have a legacy from these schools that's still happening in our communities to this day. And so this is why we do the work that we do.
Deidre Whiteman, thank you so much for joining us today.
Thank you.
Current data shows that Native American people are more likely to develop Alzheimer's and other forms of dementia when compared to their white counterparts. It is a brain disorder that slowly destroys memory and thinking skills, and unfortunately, no cure currently exists. Next month, the Native American Outreach Program at Banner Alzheimer's Institute will host its annual Caregivers Conference. I spoke with Heather Mulder, the organization's Associate Director of Outreach. Let's jump in here. Tell us how this conference first got its start.
Well, this is actually the 17th annual conference. We did have a 2-year hiatus a couple years ago, but we've been hosting this conference for 17 years, and really, this was just identifying a need. We saw that caregivers and professionals in Indian country really needed access to reliable and accurate information. And so we started the conference and have only received great response since then.
What are the biggest challenges for Native American caregivers right now?
I think a big challenge specifically for Native American caregivers is lack of internet access in many communities. So many programs, especially over the past couple years, transitioned to virtual offerings, and that excluded so many tribal caregivers from being able to access that education, that information, that support. And so our outreach program really was creative when we tried to figure out how do we still support tribal caregivers, knowing that setting up online education likely won't be reaching them.
This is an issue that it seems almost everyone either knows someone or has a family member who deals with either dementia or Alzheimer's. Tell us what some of the earliest signs are that we can observe.
Really early on, it's hard to pick up on because people are really good at compensating for the changes that they're experiencing. And we have phrases that are common parts of our nomenclature, like a senior moment. And there are normal changes that happen as a result of aging. You have a more difficult time paying attention to things, keeping your focus where you want it to be. You find you're more distractible, maybe a slower processing speed. It's harder to learn new information. It takes you longer. As opposed to someone who is maybe developing early dementia, I think one of the key differences is going to be short-term memory changes. As a normal part of aging, we expect someone to struggle more with their long-term memory. For someone who's developing early Alzheimer's disease, they're struggling with their short-term memory. So asking the same question over and over, right? Repetition is like that hallmark sign that we think of with dementia. Misplacing things and losing the ability to find them. We use short-term memory all day long. And so you'll see changes in a lot of different areas, things like being able to prepare a meal, paying their bills, cleaning their home, navigating in familiar environments. All of those require short-term memory. And so there's much broader reaching implications from having an issue with your short-term memory. I think another big difference between normal aging and dementia is going to be frequency and severity. So we talk about those senior moments, and sometimes, we have trouble finding a word and we laugh it off and we say, it's just a senior moment. But for someone with dementia, they'll also have that tip of the tongue experience, but then it's going to happen again and again. It's going to get more frequent and more severe as time goes on. And I think finally another big difference is a change in who you know that person has always been. A normal part of aging, we would expect that if you've always been very extroverted, as you age, you continue to be very extroverted. If you've always been more of a wallflower, more introverted, as you age, we would expect you to stay more of the wallflower. But for people with dementia, they experience complete swings in their personality, in their decision-making, in how they like to spend their free time. So a change in who you know that person has always been should be raising a red flag that something that's not a normal part of aging is going on.
One of the goals of this caregivers conference is to be able to equip Native American caregivers with tools to be able to speak specifically to medical professionals. For folks watching this at home and maybe can't attend, what is one of the biggest tips that you would give them?
Oh my gosh, I have two. So number one, a lot of caregivers struggle with communicating with the doctor. They take their person to the appointment and they think, well, how can I tell them what's really going on behind the scenes with the person sitting right next to me? The person likely doesn't have insight into all the changes that have been happening. And so the caregiver really struggles with, how do I make sure the doctor has an accurate picture? So a great suggestion for that is to take notes. Have a journal or something where you're writing a list of different things that you're noticing in your person down, and be really specific. Write down the time of day that this is happening, the frequency that it's happening, and then bring it to the appointment and give it to the front desk. Before the person even goes into the appointment, say, please give this to the doctor ahead of time. Try to get their email address where you could get them that information so they kind of have that before they walk into the appointment. I think another big key is always be an advocate for your person. Diagnosing dementia is not an exact science, and a lot of primary care physicians don't have a comfort level making that sort of diagnosis or don't have the experience. So if you know that something is going on and you're not getting the answers that you need, keep asking the question. Keep advocating for your person until you get to the answers that you need.
And that's a slice of our Indigenous world. For all the latest, visit ictnews.org. From all of us in the newsroom, stay safe, my relatives.
This program is made possible by the Corporation for Public Broadcasting, a private corporation funded by the American people.